is dressing your baby. So the golden rule of dressing your baby, no matter where you live and what season you're in, you want to put them in one more layer than you. So just look and see what it is that you need to feel comfortable, and you're going to add one extra layer to your baby. So a really good base layer that counts as your extra layer would be a onesie, which is essentially a t-shirt like bodysuit that is great for underneath footy pajamas. This would be a great outfit for a mild day, right, where I'm wearing a pair of scrubs. This is analogous to my scrubs plus the one layer. So you want to avoid any tight dresses or jeans for at least 6 weeks. You want to stick to things that are soft, cotton, breathable. They'll be happier, they'll sleep better, they'll be comfortable, and you'll be happier too. So you want to go ahead and wash everything that you have clothing-wise, towels, washcloths, your fitted sheet for your crib. Go ahead and launder those things in a hypoallergenic laundry detergent. Anything that says free and clear on the package is perfect. I don't have a brand that I am devoted to, but as long as it says free and clear, that's perfect. Brand new stuff, go ahead and get it out of the packaging and launder that too. Okay, let's dress our baby. All right, so I'm just gonna put baby in a very basic outfit. This onesie here has 2 snaps at the bottom, so you're gonna undo the snaps and put this on just like a t-shirt over the head. Sleeves I've found to be tricky for newborns because their natural posture is very much like this. So best way to do it is to cinch up the sleeve like you're putting on a pair of stockings. Put your fingers through, grab baby's hand and pull it through. Same on this side, cinch it up, put your fingers through, grab baby's hand and pull it through. You'll need to lift her up just a little bit to get this bottom part in between the legs, and 2 snaps. Okay, if you're living somewhere where it's very warm or hot outside, if you live in Los Angeles and it's 100 degrees outside and you'd rather not wear anything, this is the perfect outfit for your baby here, if that makes sense. But I'm going to keep going. So if you have the option between zippers and snaps, zippers all day, so much easier at 3 o'clock in the morning. Go ahead and unsnap, unzip your pajama and put them flat on your changing table. You're going to pick her up and put her directly on top of the pajama. The long sleeves, this stocking trick will really help. Cinch that up, put your fingers through, grab baby's hand and pull it through. Same on this side, cinch it up, grab baby's hand and pull it through. And then the feet. I wouldn't bother with socks. They don't tend to stay on babies anyway. Give that a zip up. And that's really it, guys. So let's go ahead and swaddle since we're here. So your swaddle blanket, go ahead and open that up all the way. Fold over any of the 4 corners, doesn't matter which one. You want to create what looks like an upside down triangle. You're going to put this triangle on your changing table and put her shoulders at the base of the triangle. That triangle has created some pockets for you to put the baby's hands in. You can tuck one end of the swaddle nice and snug around her back. You can take the extra fabric and tuck that in here. The other hand goes in the other corner of this triangle. And the remaining part tucks behind the back like a burrito. Okay. And I would recommend when you're in the hospital, postpartum nurses are pros at swaddling. I would get any tips and tricks that they have. Okay, super important, y'all. Safe sleep, SIDS prevention. So SIDS is an acronym that stands for sudden infant death syndrome, and it unfortunately is still a reality for babies. That is when a baby passes away in their sleep and there's no other identified medical cause for. for it. We don't completely understand how SIDS happens, but there's been a lot of research to find out what risk factors there are for SIDS. So these safe sleep guidelines are very much based off of avoiding those risk factors, right? So the biggest example of this is the Back to Sleep campaign. When they started putting babies on their backs to sleep in the early 90s, they saw the number of SIDS deaths decrease by 82%, which is just very, very significant. The single most important thing that you'll do to keep your baby safe while sleeping is to always put them on their back to sleep. So the ideal room temperature for your baby, the thermostat should be within 65 to 72 degrees year round. We see SIDS happening more often in the winter months. We think, believe it or not, because babies are overheating, they're overdressed. So if you want to err on the cooler side, that's always best. But 65 to 72 degrees is fabulous. Okay, you want to stay in that range. Fans are fine, humidifiers are fine. I get that question a lot too. So this no smoking sign here, exposure to second and third hand smoke, including vaping, increases your baby's risk for SIDS. So you don't want to smoke in the home. If you're smoking outside the home, you want to make sure that you're wearing a different jacket, gloves, and things. You don't want to transfer that third hand smoke to baby. There's a video on safe sleep for twins on our Instagram. Check us out at the Baby Academy US. So reducing your baby's risk for SIDS. So you want to put them alone in their own sleep area. So not co-sleeping with you, not with a twin, not with a stuffed animal or a pet, just all by herself on her back to sleep. In a crib in your room. So a more recent study was that babies who shared a room, not a bed, but a room with their caregivers, were 50% less likely to succumb to SIDS. So I know many of you probably have a nursery or something ready for your baby, which is so fun to set up. Your baby's going to get a lot of use out of that. But if you want to split the difference, right? You're not wild about the idea of putting baby in your bedroom. You might consider doing it during baby's highest risk time. So your baby's at risk for SIDS for a whole year, but we see it happen most often between 1 and 4 months old. Okay, so 90% of all SIDS cases happen in the first 6 months. So if you want to kind of split the difference and do share the room for 4 to 6 months, that might be a good idea. So D for don't fall asleep with your baby on the couch. There's a lot of episodes of SIDS with this setup of tired parents, a baby on a sofa that's not a safe sleep area, falling asleep with parents. So if you find yourself kind of falling asleep and your baby's already sleeping, go ahead and put him on his back to sleep in a safe sleep area, and you go get rest yourself. Even if you are snuggling with your baby like this, baby's sleeping, and then you fall asleep, you're tired, right? Baby could easily fall out of your arms and get themselves into trouble. So early medical advice for a baby who seems unwell. I know that's terribly vague, right? What does that mean? So babies who are not okay are babies who are floppy. They don't have good tone, right? They're very limp. They seem to want to sleep for hours and hours and not want to wake up and eat every few hours, right? When you try to get them interested in eating, they're very floppy. That's not normal. A baby who's blue in the face, blue in the chest, that's a 911. Or maybe your baby just doesn't seem right. It's just something as vague as that, right? Your intuition is telling you something's up. Pick up the phone and call. Don't be afraid to do that. I really believe in the power of your intuition, even as a new parent. Excuse me, I might have more sneezes. Feet of the baby to the foot of the crib. And G, get rid of any soft objects or anything loose or fluffy. So you want truly for your baby to be in a very stripped down sleep space, a flat, firm mattress, no teddy bears, no loose blankets, nothing plush, no pillows. That truly does keep them safe. So the things we don't recommend, excuse me, are these devices here. So if you just always go back to, is it flat, is it firm? Then it might not be safe for sleep. So this Pod Nest Boppy DockATot, those devices are not safe for unattended sleep. This pillow here is by design plush and right by that face. This brings up probably a really valid question you guys might have, which is, well, does she have a flat head? If you want me to put her on her back on a flat, firm mattress, won't she get a flat head, right? So my answer to that is doing tummy time. So tummy time is exercise for your baby that you need to do every day. And I would start that when she's around 2 weeks old. So best time to do tummy time is when your baby is awake and alert and fed. You want to put her on a pillow roll or something like this, doesn't have to look like this, but something elevated on her tummy with her arms hanging over. So the head's going to hang down at first. This is the whole point. So what you want to do is force baby to try to start to pick up her own head. And what this is going to do is really develop these neck muscles here so that she can independently turn her head, right, for later. So on day one, when you do tummy time, you might just be able to do this for a few minutes and she's going to start fussing. And so that's her way of saying, I'm tired. So you want to just bail her out, say, great job, let's do it again tomorrow. Well, the next day, hey, you might make it 5 minutes. And she starts crying, bail her out, and so on. So before you know it, she's going to be on her tummy for much longer, up like a cobra with a nice, beautiful, strong neck, so that when you do put her down flat on her back, she's able to independently turn her head and not getting a flat head. So tummy time, tummy time. So when you shop for your baby's mattress, you might be really surprised by how firm it is, but that really is all about safety and by design. So no pillow top, no loose blankets. Remember, your swaddle takes the place of your blanket, and you're putting them in one extra layer, so they should be plenty warm. So this hammock here, not a flat, firm surface. Her chin's actually going to her chest, and she's not able to breathe as easy. This here, so these wedges, we really do want baby on their back to sleep, not their side. This brings up another valid question you might be having, which is spit up. What if she chokes on spit up? Which makes sense, right? So what you want to do is after feeding, you want to burp your baby, right? And so the normal sequence of events is you feed the baby, she's full, she falls asleep on the bottle or the breast, and you're excited because you can put her down. Well, you're not quite there yet. So you want to make sure you carve out the time to burp them. So even if it seems like she's fallen asleep, babies actually love this. It won't wake them up. Put them over your shoulder and firmly pat the back. It doesn't take long, just a couple of minutes. And this will give her the opportunity to get any air bubbles out, get any extra milk out, have that big spit up in an upright position. Once you get that burp in, you can go ahead and put her flat on her back, knowing she won't have any massive spit ups. Okay, so worth mentioning that breastfed babies statistically are less likely to have SIDS. Bottle-fed babies are a lot more likely to swallow extra air. That makes sense. Sometimes bottle-fed babies will eat more than their tummies can hold. And so those bottle-fed babies really do need to be burped after every feed. Breastfed too, but especially my bottle-fed babies. Interestingly, babies who like pacifiers, not every baby will, but babies who like pacifiers, if you put them down to sleep with a pacifier, they're less likely to have SIDS too. So you just want to make sure that when you put the pacifier in, it's just the pacifier. It's not connected to anything. She needs to be able to spit that out whenever she wants. So these bumpers are not necessary because the distance of the bars is very intentionally spaced, right? No one's getting stuck between these bars. And this, believe it or not, is still considered to be a plush item that increases baby's risk for SIDS. So you truly don't need bumpers. These make the list. Every time they re-release the safe sleep recommendations, they're still on the list. All right, safe swaddling. So you want to use a light breathable blanket. So I think cotton really is your best bet, some form of cotton for dressing and for blankets. Just like when you dress yourself or just like when you make your bed, it makes sense for the season, right? You want um, things to breathe. You don't want to overheat baby. I think fleece very much overheats babies. So if you live in a cool place, you can still do a cotton weave, like a tight weave. This would be a great wintertime blanket. This here, this muslin cotton is fabulous for the summer, my warm climates. This here is a cellular blanket. You can see me through it, and it's very breathable. And this is a good all seasons blanket. So if you have any of those swaddlers with the Velcro, those are fine. You just want to make sure you're not aggressively Velcroing around the hips, can cause hip dysplasia. And you want to keep baby's shoulders, head, and neck free. So I undid my swaddle that I showed you a minute ago. But remember when we put her shoulders at the base of that triangle? We did that on purpose so that when she turns her head, she's not going up against any fabric, see? So this is the most important point of this slide is once baby can roll, no longer swaddle. So I would just everyone at 2 months, baby's gonna start to try to roll over. So go ahead and no longer swaddle. You wanna use a sleep sack. So this takes the place of your swaddle at 2 months. You put the baby in the sack, arms come out here and you zip it up and they're covered with a blanket, but they can't kick it over their face, right? So swaddle for the first 2 months, then a sleep sack. So this chart really emphasizes the fabric needs to make sense for the season, right? So TOG is the weight of fabric that you use. Obviously, when it's warm out, you're going to wear lightweight fabrics. When it's cool out, you'll wear heavier fabrics and more layers. So try not to get too bogged down in this chart. One extra layer fabric needs to make sense. So if you feel a little overwhelmed by all this and you're like, I want to overeat my baby, there's a lot to consider. Don't worry. There's a way you can check out the situation you're in and see that you got it right. Okay. So always one more layer than you when dressing baby. And this point, I think, really trips people up. 2 to 4 layers of breathable blankets. This is really just one swaddle, guys. So when we swaddled, we did a burrito. Yeah, this is 1 layer. That's 2 layers. Just 1 blanket. So if you're not sure what's going on, you want to resist the temptation to feel a nose or a hand or a foot. These areas of your baby's body are always going to be colder than your actual baby. So you want to put your hand inside the outfit on their chest to feel that core temperature. And if you're still not convinced, you can grab a thermometer and actually take their temperature and see what range are they in, right? So you can do the across the forehead thermometer. I also recommend just having one of these on hand. This will give you the ability to do a rectal temperature if you're worried about a fever. No, I would not do a rectal temperature if I was just playing with dressing. I would do either under the armpit or I would do a forehead one. But rectal temperatures are something that your pediatrician might ask you to do if y'all are worried about a fever. Yeah, so digital underarm thermometer can also be a rectal thermometer. The range is 97.7 to 99.5. So say you think you've overdressed your baby and you put your hand on their chest and they feel hot. You check their temperature and they're 99.9. Do they have a hat on? Take the hat off. Do they have a heavy blanket on? Take that off. Give it a half hour. Check again. If it's come down, then you solved your problem, right? If you have any doubt that it might be a fever, call your pediatrician. All right, so the Baby Academy's Ultimate Childbirth class, preparing for birth can be daunting, but we've got your backs. Here at the Baby Academy, we ensure all families get our Ultimate Childbirth class valued at $129 for free. That's right, for free. Did y'all know that with the Affordable Care Act, we are entitled to some preventative health care, such as childbirth classes? People do not know this. We are here to help you navigate that system. There are things to navigate the process. So book and pay for the Ultimate Childbirth class, which is $129 at checkout. We're going to send you a receipt that has all of the details that your insurance provider will require to reimburse you. You're going to send that receipt into your insurance along with the policy details, and they should reimburse you 100%. Okay, this is private insurance, but it's also Medicaid, y'all. You should be reimbursed for this. If you follow these steps and you're still getting pushback from your insurance company, we will reimburse you 100% ourselves. I love this guarantee. So there are a couple special offers. If you book by tonight, by midnight, you'll get this baby first aid component that's included for free. It's nice to kind of slide that in there, right? So you don't have to schedule one extra thing, right, in your busy schedule to do baby first aid. If you want to sign up, there is a blue tab right here that will take you to a sign up page, and you'll still be able to hear us. No worries there. But there's another value add today. We recently released an app that is pretty cool. It does several things. So what you do when you sign into the app is you tell us your due date. And so what we'll do is we will deliver short videos, bite-sized content for you that's very relevant to where you are in your pregnancy, right? It'll give you information about labor at the end of your pregnancy. It will give you information about postpartum after you've delivered and so on. It's very relevant to where you are in your pregnancy. It will also connect you to an entire community of people who are just as pregnant as you are, right? So that you can ask questions, share experiences. It's so important to have connections with actually real parents who are going through the same stuff you're going through. It really, really does matter. If you're out in the wild and you want to eat something and you're not sure if it's safe, you can plug it into this app and it will tell you if you can eat it. It's handy. Okay, so these are the upcoming dates that we have. Obviously, there are dates beyond August, of course. They're all on Saturday. There are some sold out offerings here, but yeah, more than I saw last time. There's more that are sold out, but you know, there are benefits to going live to this class. You will be able to ask questions in real time. So if you can snag a spot, that would be great. The best time to take a childbirth class live would be sometime in the third trimester. So anywhere between 30 and 37 weeks, I would take the class. You want to have time to kind of process all this information. But if Saturdays aren't really ever going to work for you, the class is still for you because remember, you get that recording. So this class really is for everyone. If you're getting a C-section, remember there's content about C-sections, and everyone needs the postpartum information too. So if you're planning a C-section, you might go into labor before then, and you would need to know what to do if that happened too. So my point is that this class really, anyone can benefit from it. So you can do the full day option, which is 9:30 to 4:30, or you could do the half day option if you wanted to do 2 consecutive Saturdays, a little bit shorter time sitting down. You can do that. Thank you guys so much for your time and attention on this beautiful Saturday. I don't know how it is where you live, but it's so gorgeous out. I hope that you guys learned something about how to take care of your baby and you feel a little less stressed. That is why we are here. Please, we hope that we see you again. I really want everyone to feel informed during this time. I want you to have agency and decisions that are being made. I want you to be empowered, right? And the best medicine to do that is to take a class. So tell your friends too. I feel like people don't know that you can get this stuff for free, and we're here to help you navigate that. Follow us on social. We want to hear from you. We want to know what content you need. So ask us your questions. Give us a follow. All right, let's see. We've got time for some questions. Okay, so how long should we wait to use a pillow for the baby? Great question. Believe it or not, you're not going to do a pillow until your baby's a toddler and they have their own bed. Yep. When to do tummy time, before or after a feeding? I would do it after. They'll be happier then. just you'll know what point of the day is your baby's active alert time. They do spend a little bit of time in the day just looking around, being alert, and not needing anything. That would be the great period of the day to do tummy time. You're welcome. Okay, Reed, if I book the ultimate childbirth class for a Saturday, but my husband is at work, will I receive a recording to watch it back with him? Yes, 100% yes, you will. And you will have access to the recording, I believe, for 6 months. So you will have plenty of time for you and your hubs to access that. Um, I think, too, you might find that you want to go back to a certain part of the class and you can just zoom to the pushing section or the postpartum section, and you might find that you reach out for this recording many times. So hi Jasmine, when using the swaddle, can baby's arms be left out for flexibility? Yeah, totally. So the reason why I tucked her arms in the demo is because babies do tend to sleep better when they're tightly swaddled as newborns. It helps them feel more safe and secure. Babies also have this reflex called the startle reflex, where they do this and they wake themselves up, which is kind of cute, except they're waking themselves up. And so when you're swaddling them and tucking hands in, they're not waking themselves up with their own reflex. Some babies, no matter how expertly you swaddle them, will always break free of their swaddle, no matter what you do, which I think is really a metaphor for their personality. Let's try to honor that. Hi, Nancy. Do I have an email address just in case for further questions? Yeah. So we are reception at your baby academy. And or you can DM us on Instagram. We have real people on the other end of that looking for your questions. Sometimes we even do a reel or do a video based off of someone's actual question, which is a lot of fun too. I hope to be doing more of that. So there are many ways to communicate. Hi, Angela and John. Is it okay to have our two cats around the baby? Yeah, you just want to make sure that when your baby's sleeping, the cats aren't in the room. You want to make sure that your baby's going to be by themselves in their own sleep area. Cats are extremely mobile and can get in bed with your baby, and I don't recommend that. You could consider having a net over your baby's bassinet or crib, or you could just make sure the cat's not in the room with them. As far as introducing cats to babies, this is such a cat thing. You just need to let the cat approach the baby when they're ready on their time. Make sure gloves when you're changing the litter box too. What's the right time to include pacifiers? When do we introduce soft toys? So I would do pacifiers if you're breastfeeding, especially. I would make sure that you both are really good at breastfeeding. You get a good latch every single time. Your nipples don't hurt. You feel good. Then you can introduce pacifiers, but I wouldn't do it right away. Many lactation consultants would tell you that they don't want pacifiers at all because they don't want there to be nipple confusion. I always feel like a baby will prefer a breast over a synthetic nipple, but so my short answer is wait until breastfeeding is well established, a few weeks, and then do the pacifier. Soft toys, you can do soft toys when they're about 2 months old. They won't really get a lot of use out of them before then. Around that 2-month mark, 3 months, you can have those Velcro armbands with a toy, like a rattler toy. Those are cute because there's a point where your baby will discover their own hand, and it's hilarious. They're like, oh my God. And they have a toy on the wrist. It's very cute, I thought. Oh, thanks, y'all. Hi, Rebecca. Do I recommend eating or encapsulating the placenta? Yeah, so let's talk about that. So there's not a whole lot of funding behind placenta encapsulation. Let's just be real. So I don't have a randomized controlled trial to give you to prove to you that encapsulating your placenta, eating your placenta helps decrease your risk for postpartum mood disorders, but that's the idea. What you're doing basically is microdosing yourself with your own hormones after you deliver by taking the capsules so that your hormones aren't fluctuating as much, and that helps with postpartum mood disorders if you're worried about that. I think a lot of people, all jokes aside, most people when they eat their placenta, they don't throw it in a blender. And I think I've done that once in my career. You can hire a placenta encapsulator in your community, and they will pick up the placenta from you in the hospital a couple hours after you deliver. You want to have a cooler, put it in the cooler, and they'll take it away and prepare it in capsule form or tincture form for you to use. And it's really just microdosing your own hormones. The only scenario where I don't recommend eating your placenta is if you develop high blood pressure in pregnancy, preeclampsia in pregnancy. That is something your placenta is doing for you. You don't want to eat a problem. Okay. I've actually seen people eating their placenta capsules who had high blood pressure, and their high blood pressure returns because they're having the capsules. Yeah, I'll show this swaddle again. Or, if you have an infection during your labor called chorioamnionitis, you don't want to be eating infected placenta. If that were the case too, your doctor's probably going to send that off to the lab anyway. So, okay, swaddle. So you open it up all the way. You fold over any of the four corners to create an upside down triangle. Let's see. Okay, triangle, yeah. You got your little shoulders at the base of the triangle. Putting her little hand in the corner of one triangle. I'm going to tuck one edge really snug behind her back. I'm going to take the excess fabric and tuck it in up here. And I'm going to put the other hand in the other corner of the triangle and really nice tuck the other end around the back. Okay. And we have, if you follow us on Instagram, we have tutorials there too. Abby, if you follow us on Insta, there is a video of what to put in your bag. I just saw it. It was like, it's maybe a week or so old, so check that out. There's a lot of things. Yeah, so baby's head shaping. There's also a video on Instagram about this too. It's the flat head. The best way to prevent that is tummy time. Yeah. Vanessa, any issues with receiving fentanyl at the hospital during delivery, pros and cons? Yeah, so fentanyl is fentanyl's got, it's a bad look right now, right? There's a lot of scary things happening with fentanyl out in the world with things being laced, right? In labor and delivery, they might offer you pain medication fentanyl in a different dose, right? A smaller dose that will help with pain in labor. If you want to do pain medication in labor, I would just go for the epidural, honestly. I feel like fentanyl is a gateway drug to the epidural, so you might as well just go for the epidural. Fentanyl is safe we usually do 50 or 100 micrograms, so a very small amount. It usually tides people over for about an hour tops. It does make you feel a bit high, like you're going to want to be in bed. You're not as able to get up and move around. It doesn't last for very long, right? And so I find that women will benefit from fentanyl for an hour tops. And then if they get another dose later, it doesn't do much. And they end up getting the epidural anyway. So they won't give you any fentanyl for any IV pain medication if they think that you're going to deliver within the hour, because they don't want baby coming out looking not performing well, not crying, not being vigorous, right? Being under the influence of fentanyl. So I just, if you're going to get pain medication, go for the epidural. Yeah. Haley, dressing for sleep in the summer, is a onesie and adding a swaddle considered one more layer than what we would wear, or does she need clothing layer on top of the onesie before the swaddle? I'm afraid she will overheat in the summer. Yeah, I totally gotcha, Haley. So if you, in the summer, I would just do a onesie with a muslin blanket. That's it. Yeah. And then remember too, you can always just put your hands on your baby and see, does she feel too hot? You can take her temperature on the forehead real quick and see if you got it in the range too. Um, Babies do oftentimes get a heat rash if they're overheating. They'll get a rash on the skin, and that goes away pretty quickly if you cool them off, meaning take off a layer. Uh, but I think you will be just fine with a onesie and a muslin swaddle. Yeah. Do I recommend in-person birthing classes or is virtual enough? You know, I feel like you can never have too much childbirth education, but this class, honestly, guys, is very robust in everything that you need to know, especially if you look back at the recording too. I do recommend taking this class, obviously, but I would consider too getting a doula if you can afford that. A doula is a person who can support you and coach you throughout labor. She's not a midwife. She can't deliver your baby. She's not a, she can't do anything medical for you, but doulas are tremendously helpful in helping you navigate when you go to the hospital. They'll help you during labor too. The reality in our healthcare system is that there's a nursing shortage, and you can't rely on having a rock star labor and delivery nurse. Probably will, but you may not keep that same nurse the whole time you're laboring, right? So wouldn't it be great to have a knowledgeable person with you 100% of the time to help you and your partner get through it, right? Doulas can also help in the postpartum period to help you navigate things. Okay, I think that's all the questions. I loved your questions. Thank you for that. Y'all, please follow us on Insta. We want to hear from you. We want to see you again. Send your friends here. And I wish you guys a safe pregnancy, a fun delivery, and just the best time with your baby. Okay? Bless. Bye, guys. Take care.